I'm here today to introduce Morgan Lamandre, who is the CEO of STAR, which is one of the state's biggest, if not the biggest, organization that helps survivors of sexual assault. Morgan's a graduate of LSU and Southern University's Law Center. She helped start STAR's legal services program that helps people who need an attorney to deal with things that happen as a result of their sexual assault in the civil space. And I'm going to say this, Morgan may not say this, but many of the laws that have been passed in the last 10 years that deal with sexual assault and survivors of sexual assault are laws that Morgan helped write or wrote directly. She knows more about this subject area than pretty much anyone in the state. Today she's going to talk to us about some of the challenges that organizations like hers are facing in light of a lot of problems happening at the federal level and the state level. So welcome, Morgan.
Thank you so much. I'm really humbled by that introduction, Julie. I appreciate that. But as she said, I'm Morgan Lamandre. I'm the president and CEO of STAR, stands for Sexual Trauma Awareness and Response. And STAR is a nonprofit sexual assault center that provides free advocacy, therapy, and legal representation to survivors in 15 parishes across central and southeast Louisiana. And just to understand STAR's role, to be eligible for services at STAR, a person must be a primary or secondary survivor of sexual trauma, which sexual trauma is an emotional and psychological impact that results from any sexual conduct that violates a person's boundaries, autonomy, or sense of safety, whether through direct contact or experience. And so, just to be very direct, because this is something that people often confuse, but STAR is not a domestic violence program, and we do not have a shelter. And while someone experiencing domestic violence may also experience sexual trauma within that relationship, the vast majority of STAR's clients are individuals who experience sexual trauma outside an intimate partner relationship. So we serve acquaintances, strangers, family members, or other non-intimate partner survivors. And that distinction matters, which I'll come back to a little bit later. But first I want to talk about the state of all victim services in Louisiana. And when I say all, I mean the services related to domestic violence, sexual assault, human trafficking, and child abuse. And what I have to say is uncomfortable, but it's exactly why it needs to be said. And so just to kind of give you, Louisiana has a very fragmented system, and our response to victims is completely broken. Not because the people doing the work lack compassion or skill, but because the state has built a web of programs that are fractured, uncoordinated, and dangerously inconsistent. And so each type of victim service is scattered across multiple organizations that rarely communicate, leaving survivors to navigate a maze that no one fully controls. So what does that look like in practice? Louisiana's domestic violence programs, they do receive state funding, roughly $7 million, and that funding is routed through the Louisiana Coalition Against Domestic Violence, or LCADV, and then they distribute that money to their members. But then if you're a domestic violence program, you also have to seek funding through other sources. LCLE, Louisiana Commission on Law Enforcement, for VOCA funds, which are the Victim of Crime Act funds, and STOP formula grants. Then you also have to go to DCFS for the Family Violence Prevention funds. And then now, with the passage of the recent Act 226 by Representative Kelly Dickerson, you will then need to go to the Office of Human Trafficking Prevention in order to get any funds that result from that act. And so one additional stop is the Office of Women's Policy in the governor's office, who then oversees the Domestic Violence Prevention Commission, which is yet another layer of coordination. Child advocacy centers are no different. They receive state funds through the Louisiana Alliance of Children's Advocacy Centers, which is also pass-through dollars from the state. And then they also have to go through LCLE to receive VOCA funds. And law enforcement planning districts are who decide how much VOCA funding goes to each CAC that applies for it, while DCFS and the governor's office also oversee child trafficking initiatives. Sexual assault services have even more layers and are spread way more widely through multiple organizations. LCLE administers our STOP, our sexual assault services, and crime victims reparations, and then the forensic exam medical payments. Then you have the Department of Health that oversees all the regional sexual assault response plans. They are supposed to ensure access to forensic exams, while the Office on Public Health within the LDH oversees the Rape Prevention and Education Grant, which is then passed through to LAFASA, which is then passed through to the member centers, and LAFASA decides who gets one of those awards. Then there's the Sexual Assault Oversight Commission. That commission is housed in the Louisiana Department of Justice, but guess what? They have no actual oversight or authority to do anything. In short, no single agency has a responsibility or authority to see the entire landscape. Funding is divided, standards are inconsistent, and no one is accountable for whether anything we do in this system actually works. So, what are the consequences of this fragmentation? When funding and oversight are divided among so many agencies, there is no statewide plan, only competing priorities and disconnected initiatives. Survivors don't experience violence in categories, yet Louisiana's bureaucracy forces them to recover in one. The result is a maze of conflicting standards, duplicated paperwork, and real people falling through the cracks. Victim services have become grant by grant survival game when those most harmed must depend on the stability of a funding priority spreadsheet. That's just unacceptable. And obviously, I think we all know who is paying the price. Right now, survivors are absorbing the cost of this dysfunction. They face inconsistent hospital responses, unclear legal processes, and agencies so consumed by grant management that the outcomes are treated as secondary. So Louisiana has turned victim services into a competition for compliance rather than commitment to healing, and we just can't claim to be serving survivors when we are perpetuating confusion, delay, and chaos in the system that re-traumatizes them. So who controls most of this federal funding that victim service providers do receive? That's the Louisiana Commission on Law Enforcement, and they are perhaps the most powerful player in the structure, controlling most or much of the federal dollars for victim services. VOCA, the Victims of Crime Act funding decisions, are driven by district-level law enforcement planning councils. They decide how much money is distributed within their districts, most, not all, but most of which do not operate with public or clear standardized criteria for who and what they give that funding for. Agencies like STAR, trying to adjust budgets or modify programs, face a constantly shifting rule book by LCLE that doesn't exist on paper. Requirements for submitting changes to our grants can shift without warning, and those rules are applied depending on who has a good working relationship with LCLE. When clarification is requested, responses eventually come, but slowly, through the United States Postal Service, instead of simply sending an email. And they send them after deadlines. So, additionally, LCLE enforces some of the most restrictive interpretations of federal grant rules in the nation, often going beyond what the Office on Violence Against Women and Office on Victims of Crime actually require. At the same time, LCLE seeks broad exceptions to its own rules when convenient, which can be found on Victim Service Advisory Board agendas to request pre-approval waivers of their own rules. Members of the LCLE advisory boards have pushed for years to modernize and clarify these policies, but those efforts have been stalled or dismissed. Despite its reach, controlling major funding streams, reparations, and forensic exam payments, LCLE still operates without a comprehensive written set of rules, procedures that are then provided to their subgrantees that would allow their subgrantees to maintain compliance with ease. Instead, we are told to just deal with it and remain silent, so we will not make LCLE mad by challenging their inconsistent grant management. I will say to you all what I said recently to one of STAR's district directors. I don't want anyone to be upset with me or my organization, but my priority first and foremost is always going to be survivors. So if I make the people at the agency mad because I'm advocating for an effective and efficient governmental agency that ensures programs are provided with the funding to then help survivors with life-saving services, then I don't care if they're mad at me. And I'm gonna have to be okay with them being mad at me. What makes our state dysfunction worse is, of course, what's happening at the federal level. So they don't stop at the state level. During the recent federal government shutdown, staff at the Office on Violence Against Women and the Office for Victims of Crime were furloughed, even though their funding doesn't require them to be, and they have not in previous shutdowns. The decision shuts down communication nationwide. Programs like STAR can't request approvals to adjust budgets, modify anything, and awards that we applied for that we have reason to believe we will get, we were unable to get the alerts to say that we did get a funding or not. So now we're having to lay off people because we don't know when we'll ever hear back about some of these grants we applied for. So when Washington goes silent and Baton Rouge has no plan, survivors pay the price twice. And then I want to return to the thing I mentioned earlier, that sexual assault is not domestic violence. And the difference is that, first off, I do want to say that both are critical issues, but they're not interchangeable. One is not the other. Domestic violence involves ongoing patterns of abuse and control within an intimate relationship. Sexual assault, however, cuts across every relationship type. It requires a distinct medical, legal, and advocacy response that domestic violence systems were never designed to provide. Louisiana provides state funding for domestic violence programs and child advocacy centers, but there are no state dollars provided to standalone sexual assault centers like STAR. And when sexual assault is treated as a subset of domestic violence, survivors are sent to programs that don't fit their needs, and the public loses sight of what sexual violence truly is. So it's time for Louisiana to stop forcing sexual assault services to fit inside a framework that was never built for them. So I do have a solution to all of these issues that I have laid out today. It is a solution that I'm speaking publicly about for the first time, and it's something that I am really going to push for. But I believe the solution is not another task force or advisory committee, but it is for Louisiana to develop a centralized office on violence against women and victims of crime. And I believe that office should be housed at the Louisiana Department of Justice and overseen by our Attorney General. The Department of Justice mission is to protect the people and resources of the state and by upholding the law. And that must include enforcing the laws designed to protect victims. I believe this office should coordinate all victim service funding streams, including all the federal funding streams that I had mentioned. So that includes VAWA, VOCA, SAS, family violence, rape prevention, and then the state general funds. And I believe they should enforce transparency and accountability across all victim service categories and develop a statewide plan for sexual assault nurse examiner coverage, advocacy, prevention, and rural access. I believe they should set measurable performance standards and publish results quarterly. And I think that they possess the legal authority to act when agencies fail, including the power to compel compliance or file suit to enforce survivor rights. When all systems operate under one roof, with clear lines of responsibility and transparency, Louisiana will finally see the full picture. the duplication, the waste, the missed opportunities, and the repeated violations of survivor rights. Within the Department of Justice, there are attorneys with the capacity and authority to act, to enforce compliance, to file suit when necessary, and to ensure that survivors' rights are not just written feel-good legislation we have on paper, but they are actually upheld. So, I believe that our current Attorney General is capable of creating the centralized and coordinated effort, and I believe this is something that we should push for. So in closing, I want to say that Louisiana does have compassionate and capable professionals working in every corner of this field, but compassion and competence mean little without coordination. A united office under the Department of Justice would give this state a clear view of what's working, what's broken, and who's responsible. Once all systems are visible under one roof, the failures, the missed deadlines, the conflicting rules, the rights ignored will no longer be invisible. And they'll all be documented, addressed, and enforced. This is how we protect survivors. This is how we restore faith in justice. And this is how Louisiana can finally move from chaos to accountability. Thank you for having me. Questions?
Have you talked to the Attorney General about this?
So the question was, have I talked to the Attorney General about this? And the answer is yes. And she definitely, I don't want to speak for her, but she has expressed interest in what I've outlined.
Other states, how they handle this? Are there models for this in other states?
Yeah, the question is, are other states, are there models for this? Yes, there is, and that's exactly some of the information I've provided to her and her staff. There are, like Wisconsin has, there's different states have different frameworks, but ours would be new based on everything I outlined. With that being said, there are frameworks. Texas oversees like sexual assault nurse examiners and sexual assault service programs. There's other states that have offices of victims of crime. I think we should mimic ours, just like the federal level, which has an Office on Violence Against Women, Office of Victims of Crime, and it's under the federal Department of Justice. I believe we should have something similar, but in Louisiana specifically.
I'd love to see some draft legislation.
Are you gonna author?
I'd love to see the legislation.
Yes, thanks.
As a former licensed professional counselor who worked in the ER and served victims, and someone who knows a lot on this subject from personal experience, I believe it's very important that you have experts that are a part of a peer review committee, to where it's not just upon a Department of Justice, but there's also some form of checks and balance, where if people are notified that the Justice Department is not doing their job, there needs to be a peer review that can come in as an outside agency, like you would have in any other department, medical departments, Department of Education, et cetera, that can respond to the needs of people who are not being met within the Justice Department and have those issues resolved. Have y'all made plans to create any form of oversight committee to make sure the job is actually serving them?
So the question was about, have we made any plans for any? This is my first time publicly saying anything about what I believe should happen, but I will, to the other points you were making, that when different agencies are violating and it's best to have like a peer review committee. As I had mentioned, we have the Sexual Assault Oversight Commission that has no oversight authority. That is supposed to be representative of a place where you can essentially do just what you're suggesting, a peer review. I believe that what I'm proposing is a coordinated effort to have just standards. Right now, we don't have any standards. Different agencies are doing multiple different things. And so I think we're kind of advocating for the same thing, that there be a system, a process where that essentially happens. So, did I answer your question? Because I guess I don't have any plans, because this is me publicly saying it for the first time, but essentially we need that kind of system that also takes into consideration the experts, because vast majority of sexual assault survivors do not report to law enforcement. And so when I say it should be housed under the Department of Justice, I believe it should be housed there for two reasons. One, LDH is too big as it is, and that would only be the other agency that I would think as a public health perspective, which I believe victim services and, responding to domestic violence, sexual assault, those are all public health issues. But because they're too big, I think LADOJ is the next, place that makes sense from a coordination standpoint, but we know it's not just about the criminal legal response and prosecution, because not all cases involving this are going to result in arrests, prosecutions, or convictions. So we need to have a space where we're talking about justice and healing as survivors define it, and ultimately that will allow survivors to feel safe to come forward when they do want to report, and then it will create a space to where Louisiana is safe. And I believe public safety is obviously one of their main concerns.
Well, if I could say one more thing, I believe that public safety is definitely a concern, finding a way to stem the number of assaults that occur and what all goes into that. But a really good thing is y'all are developing this, that you need to take counselors and people who attend the welfare, the mental health, and health department to attend the physical health of the survivors needs to also be taken into account. And then there's the various social services, and I'd be happy to talk with you more about anything you'd like to know that I've learned through all of this.
Yeah.
But I think it needs to be way more comprehensive than the justice.
Yeah, I mean, again, going back to the point I made about coordination and just the thing that was mentioned again is that I think just it needs to be more input. Essentially, I'm paraphrasing, but I'm just saying what I think needs to happen in terms of coordination. Coordination does have to involve all of those different entities. Right now, those different entities are not at the table together, and right now, most of all these funding issues and things are coming from one entity, the Louisiana Commission on Law Enforcement, which is a very law enforcement-based system. So I think that having coordinated effort in a centralized office where that would take place, because essentially right now that's not happening. I work at STAR. I have the benefit of being around attorneys, social workers, counselors, advocates. I consider myself an advocate first and foremost, but again, I think we're saying the same things, and I don't have any power. So I hope that the idea takes off, and that, the people who have the power that are in this room, one of many, but will do just that. Other questions?
Can you elaborate more on how services have been impacted by the government shutdown?
Yes, so the question is, can you elaborate more on how services have been, impacted by the government shutdown? I can speak for STAR in particular. So STAR had some different funding streams that expired on September 30th, particularly one through our state coalition, LaFasa. It was American Rescue Plan funds, as well as we had different other funds that were ending in the sense of the VOCA. People have heard over and over again, VOCA grant cuts were made. So we were awaiting awarded notices about grants that were up for renewal or continuation from the Office on Violence Against Women. We did receive one award notification right before the shutdown. I think it was September 28th. So we received that award notification. Can't do anything with it, because you can't do anything with it unless your budget and everything is finalized in approval. So we can't hire anybody, we can't spend any money. And then we are still waiting on grants that we are applied for. So without knowing what that looks like, we are having to let people go as we restructure. We paused hospital accompaniment services, which is one of the critical foundational services that we provide in sending an advocate to a forensic medical exam. right after a sexual assault. We're pausing those as we try to restructure to manage how our services will have to look like now that we don't have, any, I guess, knowledge of when funding will resume as a result of the shutdown. So it's complicated, but I think the other thing too is that with government shutdowns, we can't necessarily do budget modifications or anything that we need to in order to, best serve the survivors that we have. So it becomes pretty complicated, but essentially we don't know if we have money coming.
Would the restructuring you're pushing for help with any of that uncertainty that you're experiencing right now?
It wouldn't help with any uncertainty in the sense that we still don't have money. What we would be doing, STAR provides services beyond what our accreditation requires us to provide. And so we would be restructuring to only provide the essential services that are required of our accreditation, which is the 24/7 hospital and hotline. So we do a lot of case management. A survivor, comes in and it's overwhelming in that moment to just even fill out like an application to any kind of other social services. So our advocates are with them every step of the way, calling, housing and with them doing anything that they need in that moment to help them get their basic needs met. And so we won't have essentially case managers anymore as a result of the restructure. So.
Yes, do you plan on having any legislation coming up for the next general session this upcoming spring, and any legislation you have in mind?
There's a bunch of things that I guess, the question was, do we have any legislation in mind for the upcoming session? There's usually always something on our to-do list, I guess you could say, for legislative efforts. There's a couple of things that we need adjusted from a few years ago with the Sexual Assault Survivor Bill of Rights. Nothing major, more technical changes. There's a number of things we want to do, but it's always an effort of, balancing what we could possibly get through in a session. Right now, we really need to prioritize a funding mechanism for sexual assault services because, there's only really 2 standalone sexual assault centers. STAR is one of them, and the other is the St. Landry Evangeline Sexual Assault Center. Other programs are either dual agencies with child advocacy centers or domestic violence. Now, to have true sexual assault services, you need its own funding stream. But what happens is with domestic violence, which again, I'm not advocating in any way that they not have the money that they have been getting, but you just need a different funding infrastructure to prioritize sexual assault specific services. So I am hoping to work on that type of legislation that will allow STAR and other centers who don't really prioritize sexual assault, not because they don't want to, but because there is no funding for it, to really emphasize those types of services for sexual assault. That's what I want to work on. Yes, I'm gonna go here first.
Morgan, thank you so much for your work at the legislature, Tom with the Catholic bishops. Understanding the funding challenges, this is more of a forest question in terms of trends you see and prevention, social determinants of health. What do you see as the big picture, if you don't mind?
Yeah, so the question was, what are sort of the big pictures and as far as trends and maybe prevention for sexual assault? I think, the bottom line for what we're seeing help with prevention is comprehensive sex education. We don't mean teach people how to have sex. We mean teach people to understand body autonomy, consent, healthy relationships, unhealthy relationships, and honestly, just proper terminology of their body parts. That is effective prevention when it comes to really preventing sexual assault before it ever happens. Prevention is not, a whistle or getting a buddy to walk you to your car. That's a risk reduction mechanism, but true prevention allows for our children to understand that they have the right to say no, that they understand what consent means. I mean, if you're growing up in a house where your family is sexually abusing you and you were taught in so many ways that that is love, how are you ever supposed to know? And if you're not taught your proper terminology for your body parts, how can you truly report? So I think that, you know, we have to get away from this political, I guess, the way people are looking at sex education. I think that sometimes people, when they think of sex education, they think we're gonna just be passing out all kinds of, you know, contraceptives, and we're gonna be advocating for all this stuff that is truly not what is happening. But there is no set curriculum where people are really able to understand, you know, questions. Like, children have questions, and there's so much taboo and stigma associated with just asking biological questions about their bodies. And I think that when we create that stigma, it allows for children to believe that they can't go to adults to ask questions, and they're just going to be told, you know, okay, I'm going to go on the internet to look for the answers to my question. We all know what happens when you go searching on the internet for certain questions. And I think that that's when you get into avenues where children are then harmed by what they're exposed to when they go searching for, you know, questions. And a lot of people say, well, that needs to be taught at the home. Well, if the home includes people who are sexually abusing you, I don't think that we can trust that the home is the best and safest place for things like sex education to be taught. And I think that, you know, we need some trust in the professionals that can do this work and teach about comprehensive sex education.
Would you comment on all the book banning that's going on now with any book in a library accessible to children that deals with this?
Sure, so the question is, or I guess to comment on book banning that is dealing with this, I think that, you know, that alone is not specifically like my area in terms of like, you know, the arguments made about censorship. I am not aware of any books in the library that are pornographic, which I think is one of the things that were, you know, being discussed, or like what sections we're in. I do know that people were trying to remove different books from the library that had like rape scenes in them that were classic literature. So whether it's Maya Angelou or something, and I think that that is a disservice because rape is real. And yes, it is in books, but it is a reflection of what the realities are of people in our state are experiencing. And if we can't have it in a book, I think that that is a true disservice, because then we're once again trying to silence survivors, we're trying to silence the experiences, and then we're not taking sexual violence seriously. So I don't know if that's really what you meant about, you know, commenting on book banning, but I think that when, you know, again, there are protections and place for people, children, to not be exposed to books their parents don't want them to be exposed to. One, don't go to the library. Two, whether it's being in the library, I think that they can then, you know, watch their kid in the library. And then also, as far as access and checking out books, there's the different library card levels. When I bring my kids to the library, I mean, they are with me. You know, I have a 3-year-old who runs around, but like still, they're not pulling down books that they shouldn't be. They're not in the sections that they shouldn't be. So, is it? Okay.
I know you just mentioned this, but I know you have small kids, and I was wondering how you talk to your, if you don't mind talking about this, how you talk to your own children about these issues.
Yeah, so I actually posted something recently on my social media of my daughter. She learned, we were listening, and she learned the Private Part song. I'm sure everyone saw the viral video. And she is so fierce about it because she's known for a while. You know, we have you can't just have conversations when somebody's like 12. So you start young in an age-appropriate way about what they can understand, and you have conversations. She knows she does not have to hug anybody, and I don't care if that offends grandparents or relatives. She's not being forced to hug anybody, and she tells people she has boundaries. There's a video of her saying just that. Go see it, it's pretty cute. But, and I think that should be respected, because I think too often kids are told, oh no, you need to hug this person, or, oh, well, they gave you a present for your birthday, you need to go give them some sort of physical affection. They don't owe anybody anything. And I encourage them to have conversations and for us to talk about things. And I think that that's where it starts. So my 13-year-old, he is now 13, and I will say, like, over the years, he has grown up being sort of at STAR. Ever since I started working, he was 4 months. And I'm proud to say what I'm about to say, because I feel like it shows the trust. He came to me recently and he said, Mom, these kids on my bus were talking about pornography and that somebody had something, but he told me, and he didn't feel shame in talking to me about that. And we had an even more comprehensive, conversation about what is my belief about the dangers of that, about the legality of that. And I think that when you set up a relationship with your children where it's like, just don't do this, just don't talk about this, everything is inappropriate, they're not going to come to you. And because he came to me, I think I set him up for being in just more of a protective state as he grows and continues to be exposed to things by, I'm not saying we can't escape certain exposures, but we can do whatever we can to make sure that they have the tools they need to get out of a situation in which they are exposed to things. So it doesn't start, one day just when they're about to go to college. It has to be incremental and as they are older. The second, it's all age appropriate, but I've talked to my children for a long time now about things, and it does throw people off guard, especially when they're saying the correct terminology for their body parts. But again, I think that, that's important. So, yes.
Yes, I've noticed concern about abuse against men. We have a crisis, there's a shortage of fathers and dads, and they're having a dad and a male head of the household, strong backbone of men. And I noticed, even in some of my circle of friends, we have men that were abused, and it's harder on a man than it is on a woman. A woman can talk, a man is a project and all. It's very, very difficult for men to open up. But I notice it's getting to be a bigger crisis and all. Is that an issue y'all are handling about discrimination against men?
So the question is about discrimination against men, and if it's harder on men who are abused. So I don't think that we can say any type of trauma is harder on, one gender or the next. What I can say is that what we know from recent research from Dr. Rouge at the Tulane Newcomb Institute, they did a comprehensive statewide survey. It's actually excellent. It's helped us in so many ways. We've seen that in rural areas, young boys experience sexual abuse 3 to 6 times more likely than those in their urban counterparts. And I think that what ends up happening is that because of rural limited access to services, it is harder for individuals where we're seeing a large male population be victims of child sexual abuse. It is harder to then go on and heal. And I think that what happens, though, is that it goes back to this societal perception of how we treat men. Men shouldn't cry, boys don't cry. Guess what? They can cry. My 2 boys can cry. They have emotions, they have feelings, they need to be taught that, to be a man is it is perfectly normal to cry and to have those experiences. So I don't think that we are in a place where I've seen any kind of like discrimination against men. I think what I've seen is that our state does not allow for men to feel like they can openly talk about their abuse, because as a whole, people look at men as, oh, well, how come you didn't prevent that? Again, that's victim blaming. Nobody is responsible for preventing their own abuse. It is on all of us to not abuse. So.
Is there any overlap in services of what you and what Iris do, what STAR does and what Iris does?
So the question is there any overlap in services with what IRIS does and STAR does? IRIS is a domestic violence program. STAR is a sexual assault center. Services are distinct and programs are distinct. IRIS as a domestic violence program has a shelter, and they still have a hotline, but remember, their focus is on individuals who are abused by an intimate partner, including those in a dating relationship. STAR can serve anyone who's experienced sexual trauma in any relationship. Vast majority of our survivors, though, don't have, I guess you could say, have not experienced sexual trauma within an intimate relationship, because most of the time, if you're a domestic violence survivor who's experienced sexual trauma, you're eligible for services at a domestic violence program. So the opposite is not true. If you're a sexual assault survivor who was raped by a classmate, let's say at LSU, when you go, you can't get services at IRIS if you did not experience sexual trauma or domestic abuse at the hands of an intimate partner. So I think that it goes back to people think one type of service is needed over the other. They're both needed. They're both important. And, you know, there's a place for all of them, including the child advocacy centers. So.
I'm going to, does anyone have one last question? All right, I think that's it for Morgan then.
Thank you.